Dear friends from media, good afternoon. As arranged by the COVID-19 Task Force in Beijing, we are hosting the 144th COVID-19 briefing in Beijing to answer questions from the media. At present, we are still facing a sophisticated situation. We would need to be perseverant with our efforts if we want to claim victory, and we have to be fastly responsive and targeted. We need to follow the targets of bringing down the COVID cases to zero and fight the resurgence of the COVID-19 cases. We have to adopt a result-oriented approach, accelerate our efforts in epidemiological surveys, engage in contact tracing, and bring those with close contact quarantined. The suburban area, they could become a potential risk area, and we have to closely look at these people who have close contact with the confirmed cases. We also need to hold different levels of jurisdictions accountable and focus on key industries, key groups of populations, and key industries. Delivery service, maintenance services, and restaurant service people, they feature a higher level of flow, and they are also working in a closed-off area. So we have to be very careful with the preventive measures of those groups of people. In the meantime, we have to focus on the containment measures at the closed-off areas and control areas. We also need to dynamically adjust the closed-off areas and the control areas, and where those areas should be released of their control measures, we have to do that immediately. In the meantime, we have to refrain from people gathering so as to ensure the safety of each and every one of us. We also need to continue working from our homes when we are working at homes, refrain from going outside, from traveling, and from gathering in public outdoor places. And different workplaces have to be held accountable for closely observing these measures. We have to close the loopholes, and public outdoor places have to do a good job in COVID-19 control. And grassroots workers must do a good job in personal protection. They have to very scientifically design their daily work schedule, and community services must do a good job in serving people living in different communities. And today we have Wang Xiaoe from Beijing Municipal and Health Commission, Song Wei, Deputy Publicity Director of Haidian District, Xiao Dan, Publicity Director of Haidian District. And we also have with us Mr. Wu Hao, Head of Community Infectious Disease Prevention from Beijing CDC. May I first give the floor to Liu Xiaofeng, Deputy Head of Beijing CDC, and he will give you an update about the COVID-19 cases in Beijing. Dear friends from media, good afternoon. On May 23rd, we have added 48 new cases, including 2 asymptomatic cases who have been transformed into confirmed cases. We have 7 from Haidian, 4 from Tongzhou, and 2 from Dongcheng and Xicheng District, and 1 from Chaoyang District. We have 1 regular case, 40 mild cases, and 7 asymptomatic cases, and 45 cases currently under quarantine. Yesterday from 3 o'clock p.m. to 24 o'clock, we have controlled 11 potential cases, and we also have identified one case in Tongzhou District. Today from 0 o'clock to 13 p.m., we have added 13 new cases. The other cases from 1707 to 1729. We have 5 from Fengtai and Fangshan, 2 from Changping, Dongcheng, Xicheng, and Shijingshan. They each registered 1 new confirmed cases. And we have 3 asymptomatic cases and 21 patients. They are placed under quarantine and medical observation. And they have all been transferred to designated hospitals, and relevant personnel, they have been quarantined according to our standards. And now let me report to you the confirmed cases from 3 p.m. yesterday to today. 1678 is living in Zhangjiakou. He is a delivery man, and on May 17th, he traveled to Dongcheng District's Oriental Plaza for a delivery service, and following that task, he had diarrhea and high fever. On May 22nd, he went to the hospital, and on May 23rd, he was diagnosed as a COVID-19 patient. 1736 was identified through massive nucleic acid testing. On May 22nd, he went to Xinmin vegetable market, and on May 23rd, he was diagnosed as a asymptomatic case. 1725 was identified through NAT campaign. He is now living in Fengtai District. On May 24th, he was tested as positive for COVID-19. He is now categorized as a mild case. From April to today, we have reported a total of 1,791 cases, and we have 410 from Fangshan. In Haidian, we have 201 cases, and in Tongzhou, 78 cases, 41 cases from Shunyi, 35 from Xicheng, and 24 from Dongcheng District, 21 from Changping District, 16 from Shijingshan, 5 from Mentogo. In Miyun and Yanqing, we have 5 cases, and in Huaizhou, we also have 5 cases. And since this current wave of pandemic, we have no cases from Mentogo or Yanqing. In general, the situation has been well under control. In Shijingshan, Miyun, and Huaizhou, for more than 10 days, they have reported no cases. In Dongcheng, Xicheng, Chaoyang, Haidian, Fengtai, and Fangshan, Tongzhou, Changping, Daxing, and in those districts, we have new added cases for 9 consecutive days, and the situation is still pretty severe. We have sporadic cases, so we have to follow the approach of speedy control and responsive measures so that we can cut the transmission of the virus. And delivery service personnel and maintenance service people and home service people have to do a better job to reduce the flow of personnel. They have to closely observe the COVID-19 rules that we have set at the municipal level, and different companies, they have to do a good job in point-to-point regulation and management. Management rules must also be preserved and must also be observed at the village and community level. And medical people and people practicing nucleic acid tests and also grassroots medical workers must do a good job of personal protection. They also need to remind the citizens of the city to closely follow the rules of the city and also the information that is disclosed by the municipal authority, and whenever there is a pop-up on your health code, you have to immediately report the situation to the local authorities. And now let me update you about the status of control levels as of today. According to the categorization standards of risk in Beijing, we have 3 cases in Chaoyang, 2 in Haidian. In Tongzhou, Wujiafa village, for the past 14 days, they have reported only 2 cases, and so from today on, they will be elevated to a medium risk area. In Haidian District, the Kangjiayuan community is reduced from medium to low risk area. Shibali Dian Township and Shilihe village and Xiaoji village, and also Jinyu Fengyuan community in Chaoyang District over the past 14 days have reported 1 case. And the Jinsong sub-district and Dajiaoting over the past 14 days have reported no cases. So they have thus been reduced to a low-risk area. So we have 9 high-risk areas and 23 medium-risk areas. Thank you very much, Liu Xiaofeng, for your report. May I now give the floor to Deputy District Mayor of Xicheng District, Madam Song Mei. Dear friends from the media, good afternoon. Now let me report to you the COVID-19 situation in Xicheng District. From 3 p.m. yesterday to 3 p.m. today, in Xicheng District, we have added 1 asymptomatic case. And now let me report to you his basic whereabouts. He is currently living in Courtyard 113 in Gulo West Street of Xicheng District. From May 18th to 22nd, he has been tested negative for COVID. On May 23rd, he did another test and was tested positive. On May 19, from 8:20 to 8:24, he went to the Daoxiangchun outlet in Dianmen. From 9 o'clock to 9:13, he went to a Chinese hospital in Gulo. Then he went to a Xinmin vegetable market. From 5 to 9:30 on May the 21st, he went to the Gulo vegetable market. On May 22nd, from 8:32 to 35, he went to the Makai restaurant in Dianmen. From 8:45 to 8:45, he went to a restaurant called Ya Li Ji in Xicheng District. And now let me report to you the measures that we have taken. The Xicheng District has initiated a number of emergency measures, such as epidemiological surveys. We have identified the different risk sites according to our assessments and based on the whereabouts and travel history of the confirmed case. We have decided to close off the neighborhood of 113 of Dianmen Street in Xicheng District, and we decide to disinfect the whole area and bring relevant personnel under medical observations. In the meantime, at the closed-off area and control area, we're going to do a good job in supporting their day-to-day needs. In the meantime, we will focus on those key groups of people who have special needs. Here, I would like to remind our citizens that unless necessary, refrain from traveling outdoors or gathering in public places. And thank you very much for your understanding and support to the COVID-19 work in Xicheng District. Thank you very much, Deputy District Mayor of Xicheng. I may now give the floor to Xiao Dan, Publicity Director of Haidian District. Thank you very much. And good afternoon to all the journalists from media. Now let me report to you the latest situation. From 3 p.m. yesterday to 3 p.m. today, Haidian District has added 9 new confirmed cases, and they have all been identified from the designated isolation sites. Case number 1 lives in cultural number 19 in West 3rd Ring in Haidian District. On May 19, he was put into collective quarantine, and between May 19 and May 22nd, he has been tested positive, and yesterday he was tested positive. Case 2 was originally a close contact to a confirmed case, and he has been put under quarantine. And in the past few days, he has been tested negative, but yesterday he was tested positive. And case 3 lives in Yue community in Haidian District. On May 19th, he was put into collective quarantine because he was a close contact, and on May 23rd, he was tested positive. And case 4 lives in cultural number 13 in Wanshou Road of Haidian District. Between May 19 and May 22nd, he has been tested negative, but yesterday he was tested positive. And case 5 lives in Lianhua community. On May 22nd, he was put into collective quarantine, and in the following days, he has been tested negative, but on May 24th, which is today, he's been tested positive. And case 6 lives in the Yue community in Haidian District. On May 14, he was designated as a close contact, and today he is tested positive. And case 7 and case 8 are family members, and they live in Tongjiafen village of Haidian District. On May 22nd, they were quarantined. They have been tested negative before positive today. Case 9 lives in Puhui Nanli in Yangfang Dao. And on May 10, he was put into quarantine. And between May 11 to 23rd, he's been tested negative, and today he's been tested positive. So now let me report to you the risk areas that we have identified. On May 20th, at 8:15, Banbi supermarket, and May 28:30, Banbi Jia supermarket in Haidian District. And those who have visited those supermarkets over the past few days are requested to report the situation to local CDC authorities. We are going to step up our efforts in containment and management at the closed-off areas, and we have 23 of them, and 8 management and control area in our district. At the closed-off area, people are not allowed to walk out of their doors, and at the control area, they are not allowed to go outdoors unless they are traveling out through their garbage or for NAT. Over the past few days, a number of closed-off areas have been released of their closed-off measures, but this does not mean that we can be complacent. And even after the lift of those closed-off measures, we have to be very careful in observing the COVID-19 measures, and they have to do a good job in monitoring their health status. In the meantime, they have to closely watch the health situation of themselves and also those they live together with. Thank you. Thank you very much, Xiaodan. And now let's give the floor to Wang Xiaoe, member of the party leadership group of Beijing Municipal Health Commission. Dear friends from media, and now let me report to you about the NAT we have had over the past few days. On May 23rd, we have taken a total of more than 15.21 million samples of nucleic acid test. There has been two tubes of positive results, one in Tongzhou and one in Haidian. And we are currently doing the epidemiological survey work. And over the past few days, some people have been very cooperative in taking the NAT. Please, personnel and volunteers and grassroots workers, they have been working around the clock. And here I would like to pay a special thanks to all the people who have been supporting our effort. At present, we are still faced with challenging situation of COVID-19 in a city. We cannot be complacent. We cannot slacken our efforts. We request different jurisdictions and local governments to closely observe the COVID-19 regulations and rules, do the NAT, and also different governments and workplaces must carry out the COVID-19 measures, and all the residents in Beijing are kindly requested to be cooperative in this process. Thank you very much. And now, let me announce some of the additional measures that we have worked out at the COVID-19 task force in Beijing. I will announce a 6-point measure. Dear citizens of Beijing, we are still in a very severe situation of COVID-19, and there has been cluster infections involving restaurant personnel and delivery service personnel. In order to cope with the situation, we have established a work mechanism that deals with this situation. We have formulated 6 control measures, and now let me report to you these 6 measures. And first, we have to hold different workplaces and authorities accountable. And different workplaces have to be responsible for the COVID-19 measures involving their maintenance staff and restaurant and beverage and delivery service personnel. Whenever they have to use a staff from a third party, they have to jointly be held accountable for any potential infections. And those who result in an infection case due to their non-compliance to those measures will be held accountable. Second, we need to collect the information of people working for beverage and restaurants and delivery services to make sure that no one is left behind. And number 3, to do a good job in routine COVID-19 control. Each workplace has to designate a special staff to work on COVID-19 control, and key organizations must practice closed-off management, and different authorities and workplaces must do a good job in vaccination and also the check of health code. And when they are at work, they have to wear a N95 mask. Number 4, avoid people gathering. And different workplaces have to dissuade people flow across different districts. Workplaces must design a scientific workflow or routes within their workplaces, reduce the number of staff working physically so as to reduce the risk of infection. And number 5, strengthen management over dormitories, and different workplaces must do a good job in improving the conditions of dormitories for their staff, reduce the intensity of people gathering, at dormitories, ensure ventilation and cleanliness and disinfection on a daily basis at the dormitory room, and also they have to do a regular nucleic acid test. Number 6, strengthen awareness and training programs, and different workplaces must do a good job in strengthening the awareness of employees in COVID-19 control, cultivate the habit of personal hygiene, and closely observe the different COVID-19 rules in the city. Last but not least, we request all the service personnel to pay close attention to their own personal health status, closely follow the COVID-19 rules in the capital city. And thank you very much for your understanding and cooperation. And now the floor is open for questions. Please identify yourself before raising the question. First question, please. I'm with the Beijing Youth Daily. Today, we saw that Beijing is recruiting NAT staff, and what is the specific requirement and criteria for those people practicing nucleic acid test? Thank you very much for your question. And today, I think many of you have seen an announcement. Today, the Beijing branch of the Chinese Academy of Medical Sciences has released an announcement. Starting from May 24th, we are recruiting or publicly soliciting volunteers practicing nucleic acid tests in the city. And the purpose is to do a good job in COVID-19 control in the city so that we can further improve and refine the staffing of the COVID-19 team in Beijing. And let me tell you the main criteria. Number 1, the age should be below 65. They must have experiences in medicine, and we welcome students from relevant academic backgrounds. And secondly, students aged 20 and above with an experience or background in biomedicine and clinic trials or traditional medicine. And those who are interested, they can log on to the Volunteer Beijing platform. The Beijing branch of Chinese Academy of Medical Sciences will look into the registration information, and we will organize a professional training, and those who go through the training and qualify will become a NAT personnel in Beijing. And according to our collective arrangement, they will be dispatched to different NAT sites. We encourage those qualified candidates can take the initiative to sign their name up for this campaign, and they can gain more information from the Beijing Municipal Health Authority and also from the Beijing branch of Chinese Academy of Medical Sciences. Next question, please. Thank you very much. I'm with physics. I'm with Phoenix News. So Beijing has stepped up its management on key road centers, and what are the specific measures? Thank you very much. Mr. Wu Hao will answer your question. Well, the city currently is still in a very serious situation in terms of COVID-19 control, and there are cluster infection risks at different communities. We are practicing draconian measures, for example, checking people's health code and records of nucleic acid test, and this can effectively reduce the unnecessary person flow between different districts. In the meantime, by looking at their nucleic acid test, we can exert this pressure just so that people can take the initiative to take the nucleic acid test on a more regular basis, and this will enable early identification of potential cases. Even when there is a case identified, we will be able to leverage on those information so that we can support the epidemiological survey work. From the experience of different localities in China over the past 3 years, that one of the lessons that we can draw is that those who do a good job in maintaining entrance control are the ones that can very quickly get out of the pandemic. So that's why we request community workers to continue do a good job in checking the whereabouts and health code and NAT record of all the people entering in the community. So let's hope that we can do the test in a scientific manner so that we can win this battle as soon as possible. Next question, please. I'm with Beijing Traffic Broadcasting Station. In Beijing, some of the closed-off communities or neighborhoods, they are being released out of their neighborhoods, and those measures, they are being lifted up. And what are the measures that we have to guard against the potential cluster infections? Well, thank you very much for your question. And Mr. Wu Hao will answer your question. So we have many different control measures, for example, close up the area or control the area or manage the area in a closed-loop manner. So recently, as some neighborhoods are lifted of their closed-off measures, people are allowed to travel out, but this does not mean that there is zero risk. This does not mean that we can stay in complacency. And we cannot lower our guard against potential risks, and we need some additional measures. Specifically, number one, follow the requirement of different localities and do a nucleic acid test on a regular basis. And number two, closely watch your own health status, and whenever there is fever or other symptoms, report to the local health authorities. We need to refrain from people gathering or eating in a restaurant. We advise people to continue working from their homes. Even when working in a workplace, we need to avoid people gathering. And when we go out, we have to wear a mask, use the disinfectants in a proper way, and refrain from taking public transportation and maintain social distancing. Next question, please. Thank you very much. I'm with CMG. So there are still risks of COVID infections. So what measures do we have to contain the transmission of the virus? Thank you very much for your question, and may I give the question to Mr. Wu Hao from Beijing CDC. So we're talking about supermarkets and vegetable markets. Those are places where transmission is highly likely and the risk is very high, and those are the key areas that we have to pay close attention to. Over the past few years, they have been the main source of epidemic. And you can see that today we just had a new case identified in Xicheng from a vegetable market. So we have to do a good job in improving the cleanliness of the environment, do a good job in disinfection, and when residents go to those places to purchase goods, they have to protect themselves very well, wear a mask, and before the shopping, make sure that you have a mask, you have sanitizers, make sure that you work out a list of grocery. At the vegetable markets, we have to very carefully contain the overall number or the overall scale of shoppers. When we go out, refrain from taking public transportation means, and we advise people to either take a bicycle or drive to the vegetable market on their own. In the meantime, throughout the whole journey, make sure that you have your mask on your mouth. Do not touch your eyes and mouth and nose. Reduce the overall shopping time. Refrain from going to stands where people gather. Maintain a distance of at least 1 meter with others. And after shopping, dump the mask in a dustbin. Sanitize your hands or wash your hands very carefully with soap. And if you suspect that there might be some infections, then disinfect the plastic bag that is carrying the vegetable that you just purchased. Next question, please. All right, there's no question. Thank you very much to all the journalists, to all the working staff, and to our guests. This is the end of today's briefing. Thank you.